Let's imagine for a few seconds Arkansas a healthy state. Obesity, diabetes, and heart disease rates low. People are exercising, eating healthy, and educated on their health conditions and visiting primary care physicians routinely. People have easy access to care and healthcare costs in the state of Arkansas decreases and everybody is happy, right? Well, let's snap back into reality. Obesity, diabetes, and heart disease rates are high in the state of Arkansas. Access to care is available, but it's difficult with long wait times, and people in the rural area have to travel long distance. Healthcare costs in the state of Arkansas are continuously increasing. Hello, my name is Xavier Latimer. I am a Doctor of Nurse Practice student at the University of Arkansas for Medical Science College of Nursing. Today I am presenting to Asa Hutchinson, Governor of the state of Arkansas, in the support of nurse practitioners for full practice authority in the state. So who are advanced practice registered nurses? Well, they are nurses who have gained a master's or doctor's degree in nursing. They have completed advanced classwork in the required clinicals for their study. Like physicians, they can pursue in any specialty or primary care. Majority of them choose primary care. Currently, as of today, there is a shortage in primary care providers due to medical students choosing specialty over primary care, leaving less primary care physicians in the rural areas, which increases health issues such as diabetes and obesity within the rural communities. The shortage of primary care physicians have been addressed with telehealth and collaborative care with nurse practitioners and physician assistants, but that's not enough. That leaves limitation to the physician's time, and HIPAA violations could be violated and insurance purposes bills differently. APRNs are needed to improve the surge. Their current practice or policy for APRNs is that they are to practice under a physician supervision known as collaborative agreement, limiting them to writing certain prescriptions and providing care that is within their practice. So with that being said, advanced practice registered nurses, they need a physician to be able to practice under collaborative care, but there's a shortage in primary care physicians. These physicians are limited to the number of nurse practitioners, which still limits the access to care and make it difficult for nurse practitioners to practice to their full potential. So what do I want? I want to improve access to care for people in the state of Arkansas by letting the advanced practitioners, registered nurse, practice to their full potential so they can improve the health care in the state of Arkansas. I believe nurse practitioners should be granted full practice authority for all the advanced class works that they have put in and clone clinical hours just like physicians so they can participate in providing in the primary care needs within the state of Arkansas. So next question is what needs to change? Approval of a policy that requires advanced practice registered nurses to have independent practice without collaborative care with physicians, improving the primary care's needs for the state of Arkansas. Use of advanced practice registered nurses where they can improve all the healthcare issues within the state by evaluating patients, providing access to care, diagnosing conditions, ordering and interpreting tests, manage treatment plans, and prescribe medication without limitations. The advanced practice registered nurses are not going to graduate and then jump into the primary care physician role. They have to meet the requirements to have full practice authority in order to do that. With that stated, rules will be put in with the policy. With advanced nurse practitioners granted full practice authority, they will be able to write prescriptions without no limitations, but they have to grow through pharmaceutical hours to make sure that they understand prescribing um, rules and indications. There will also be a full practice authority board that will review all the requirements for nurses be approved to practice in full authority, along with the requirements of the number of years, hours to practice before going independently, and the number of pharmaceutical hours required. Approval of this full practice authority will improve and increase access to care for patients in the state of Arkansas overall, especially in the rural areas. They will not have to even travel far distance to come for their primary care physician. Nurse practitioners be able to practice independently, possibly creating new clinics where nurse practitioners open up new clinics, have their new offices. There will be more physicians to go to. People will have a choice to go to see a nurse practitioner or a doctor. Overall, the main focus is full practice authority. Everyone will have access to care from infant to child. Full practice authority will create opportunity for everyone to live a healthy lifestyle. And also, the last but not least benefit for nurse practitioners having full practice authority is spending time with the patient to educate them on healthy lifestyle habits such as eating healthy, exercising, and going over their plan of care and how they'll manage it at home. Okay, let's move to the future. Like I said, we want healthy Arkansas. We want our people to be healthy. We want people to change their lifestyle, decrease health issues, and decrease health costs. Approving full practice authority for nurse practitioners will help that.